Knock, knock, knock. Washing hands. Hi, my name is Catherine. I'll be your student physical therapist today. How are you? Good. Okay, so I see you're here to get 2 assessments. Before we begin our treatment or testing, I do have a few questions to ask you. So what is your name and date of birth?
Yan Kong, April 28, 1996.
Okay, I'm gonna just double check with your badge, and I do see it's you, Yan, so perfect. Do I have your consent to perform 2 examinations on you today?
Yes.
All right, so the first examination we're gonna do is gonna be a subtalar joint inversion test. I will be measuring how far of inversion your subtalar joint can go. Subtalar joint is essentially just the calcaneus and the talus. So what I'm gonna have you do is lay down on your belly, please. Okay, so here you are, feet are out of the bed, good job. So what I'm gonna do is I'm gonna align my axis with the posterior ankle using the medial and lateral malleoli as my axis. The stationary arm is gonna go on the posterior midline of the tibia. This is a good place to be. And then my stationary arm, which is my distal segment, is gonna move with me passively while I bring Yen into inversion. So Yen, this is passive, meaning I'm doing the movement, okay? You're gonna feel me move your leg into inversion, soles inward. All right. I'm starting to feel my R2 resistance, so I'm gonna stop here. And that is at exactly 20. I'm gonna relax her leg now. 20 is a good place to be. It's actually the standard for ankle inversion. So good job, Yen. You have good range of motion in your subtalar joint. Now I'm gonna have you go ahead and lie down on your back. This test is called a manual muscle testing. I'm gonna be checking for the strength and the tibialis anterior muscle. That's gonna be doing dorsiflexion. So that's essentially just bringing the toes to her body. If my patient can do that actively by herself, then she automatically scores a 3. So let's check if Yen can do that. Yen, when you're able, go ahead and point your toes to your body. Or sorry, passively. So I do the motion too. Good job. Okay. So she automatically scores a 3. I also see that she's able to do it passively when I move it, showing that the joint capsule is not compromised. Everything should be working well. There you go. Okay, and when you're able, you're gonna do this movement towards your toes. I am gonna prevent that motion by doing the opposite. You're gonna feel some pressure, but try your best to not let me break you, okay? Go ahead and point those toes to your body. I am gonna go ahead and grab it here, bring it into plantar flexion, and I'm gonna stop because I can't, so that automatically gives you a grade of 5 out of 5 on the MMT scale. All right, do you have any questions for me?
No.
All right, thank you so much. Yay!